Hi everyone. I am Muhammad Yasir Rafiq. Today I will talk about vital signs. So let's get started. Vital signs are used to measure the body's basic functions. These measurements are taken to help assess the general physical health of a person, give clues to possible diseases, and show progress towards recovery. The normal ranges for a person's vital signs vary with weight, age, gender, and overall health. The four basic vital signs include temperature, respiration rate, pulse rate, and blood pressure. The average body temperature is 98.6 Fahrenheit. But, normal temperature for a healthy person can range between 97.8 to 99.1 Fahrenheit. Body temperature can be measured by using thermometer inserted into mouth or placed under armpits. Any temperature higher than the average body temperature can be considered as fever. Drop in body temperature below 95 Fahrenheit is defined as hypothermia. Body temperature can vary other than infection or illness. Stress, dehydration, exercise, being in hot or cold environment, drinking beverages, and thyroid disorders can influence the body temperature. A person's respiratory rate is the number of breaths you take per minute. The normal respiratory rate for an adult at rest is 12 to 20 breaths per minute. A respiration rate under 12 or over 25 breaths per minute while resting is considered abnormal. Among the conditions that can change a normal respiratory rate are asthma, anxiety, lung disease, use of narcotics or drug overdose. Your pulse rate is the number of times your heart beats per minute. Pulse rate vary from person to person. Pulse rate is lower at rest and increases when you exercise. A normal pulse rate for a healthy adult at rest ranges from 60 to 80 beats per minute. Women tend to have faster pulse rate than men. Your pulse rate can be measured by placing your two fingers between the bone and the tendon over your radial artery, which is located on the thumb side of your wrist. When you feel your pulse, count the number of beats in 15 seconds. Multiply this number by 4 to calculate your beats per minute. A faster than average pulse rate can indicate such health problems as infection, dehydration, stress, anxiety, a thyroid disorder, shock anemia, or certain heart conditions. Some medications, especially beta blockers and digoxin, can slow your pulse. A lower heart rate is also common for people who get a lot of exercise or are athletic. Blood pressure is the measurement of the pressure or force of blood against the walls of your arteries. Blood pressure is written as two numbers, such as 120 by 80 millimeters of mercury. The larger value is called the systolic pressure when heart contracts, while smaller value is for diastolic pressure when heart is at rest. Normal blood pressure for an adult at rest is 120 by 80. A systolic pressure of 120 to 139 or a diastolic pressure of 80 to 89 is considered prehypertension and should be closely monitored. Hypertension is considered to be a reading of 140 by 90 mm of mercury or higher. Blood pressure that remains high for an extended period of time can result in such health problems as atherosclerosis, heart failure, and stroke. Hypotension is a reading of 90 by 60 mm of mercury or lower, which can be normal for some people and not a cause for concern. However, if your blood pressure causes signs or symptoms such as dizziness, fainting, nausea, cold sweats, and blurred vision, talk to doctor to discover if another condition or illness is behind the problem. I hope that video was informative and you all enjoyed it. Thanks for watching. Take care. Bye.